Fixing back pain isn't one simple thing. We really need to have a routine around it. And so in this video, we're gonna go through a hip stability routine where we can strengthen through our hips and really talk about the biomechanics so that we're strengthening through the hips and we're moving through the right area. So let's get into the video. We really need hip stability, but we also have to have hip mobility. So when I do this and lift my leg up, I should be able to keep my core and my spine in one position with my hip moving around. So hip mobility and hip stability go hand in hand. So when I'm coming here and I do a squat, we have something called a butt wink. So as soon as my hips tighten up, my pelvis is gonna tilt down. So now I'm moving through my low back right here, right? So moving through my low back each time I get that butt wink. We want to get more hip mobility. Leave us a comment if you want hip mobility exercise. We'll go through that. We've got to have hip mobility, but for the purpose of this video, we're going to work on hip stability and we're going to put together a routine. The better you are with your stability in the hips, as you gain mobility, you're going to be able to get more out of your hip mobility because you have the strength to be able to take up that mobility that you're gaining. What we really want is we want that power drive from our hips. So we want to keep your Superman or your Superwoman emblem. We want them stacked over our belt buckle. So I'm pushing off of my hips right here and pushing off of my hips, pushing off of my hips. So that motion is coming through my hip and it's not moving through my low back. And that's how I'm going to limit the irritation that I cause on my low back. Because if I step over myself, now I'm putting a lot of pressure on my hips and I'm rotating my spine. Also, if I don't push off well for my hip, then I turn this way and I'm initiating the movement through my low back each time. That's going to cause us problems. So everything we're going to be focused on is getting that hip drive and being really strong from our hips right here so we can drive out and keep that belt buckle and that Superman emblem stacked over each other. Now, everything that we do, we're gonna start with a rollout because we wanna get those muscles gliding across each other. So I'm gonna get against the wall. I wanna dig right here into my butt on the side. And so I get against the wall right here. So I start out sideways, I turn about 30 degrees, I unweight this leg and I'm digging out those muscles. And this should be tender. I found a tender spot right there. So it's right here on my glute, and I'm digging this out for about a minute. So before I do any of these hip stability stuff, I'm gonna loosen up those muscles so I can use them more effectively. When we do these hip stability exercises, we always use a band and we use it around the legs. So this one is a little bit tough to put on. We gotta slide it over our feet. So I'm gonna show you one with a little buckle right here. So I get this buckle. We can put a link in the description for getting these buckles. We find that our clients that can't get up and down from the ground really prefer to do these buckles. So I'm coming above the knee so I know where my pressure is coming from. And so I can push my hips out to the side and really fire the outside of that glute. So when I do my hip hinge, I'm gonna start off with just doing 10 hip hinges because I wanna warm up those glute muscles. I'm pushing apart while I do this hip hinge, and we typically do it against a wall. So I'm gonna reach back, measure my foot away from the wall, and then I'm allowing my face to go down with my chest, reaching back with my butt. It's like a pendulum just coming down and back. I'm shifting that weight and I have this pressure on the outside of my knees. So I'm really shifting like I'm trying to rip the carpet. I'm pushing out on all of the outside of my foot and I'm driving apart from the floor and driving back and maintaining this position right here. I'm just gonna do 10 of those to start my warm up and then we'll get into the other exercises. We're gonna do everything with a set of 10 and we're gonna go through it 3 times. So I just did my hip hinge squat. That was part of my warm up. I rolled out. I did my hip hinge squat. I did 10 reps. Now I'm gonna do my teeters. So what I'm gonna do is I wanna stay stacked right here. So I'm gonna tighten up my core and then I'm gonna tilt on one leg and then the other. You notice that there's no movement happening at my abdomen at all. What I don't wanna do is this, shifting up. So that's me doing side bending and I'm lifting my leg. I'm teetering on one leg and then teetering on the other and keeping this core tight because I want to disassociate the motion from my hips and my abdomen because I need these to move independently from my low back. So I'm just doing 10 on each leg, sliding from side to side, and my feet are pointed almost inward, maybe straight to inward, but I don't want them to be turned out because then I would be using a hip flexor. So making sure our foot orientation is really good. So I do 10 of these, and then now I'm gonna do this banded box exercise, and this is really effective. So I come over here, I'm kicking my butt back in that hip hinge position right here, keeping my chest down. And then I'm doing small little steps, 1-inch little steps. I'm gonna do 10 of them, sliding over to the side, doing this, trying to think that I have a pipe running through my hips right here. Small little steps coming across. And then now I'm gonna do 10 with each leg, going backward, 1-inch little steps. As if somebody's pulling my butt backward and I keep my chest down, my butt back. I'm doing 10 little steps, 1 inch coming across. This really burns your glutes. And then I'm doing those 1-inch little side steps. If you see that I'm going 2 inches, it's because I'm getting tired. So really focus in on what you're trying to do. 1 to 2 inches is okay, but 1-inch little steps. And then now I'm driving forward as if I have a small person pushing me up from my butt. I'm pushing forward, driving through the heels of my body and the outsides of my feet. Turn those feet in just a little bit. And I got 10 little steps coming forward like that. So that's my banded box. So I do 1 round of that. Once I get to that last position, I'm gonna do a single leg stance toe tap. So what I'm doing is driving this knee out to the side, get my chest down, my butt back like this, and then I'm gonna do a little tap, but I'm not weight shifting. So I don't wanna weight shift over to the side and weight shift back. What I wanna do is just a little tap coming back and forth, maintaining this position. I'm doing 10 of them, and then I'm gonna switch, keeping that knee really still. What we see a lot of times if we have weakness right here is that our clients are doing this. They're weight shifting back and forth, so they lose that pressure on the leg, or they're shifting around and I'm losing that glute activation that's pulling the femur out to the side. So I maintain this position and try to keep that knee as still as possible right there. I do 10, now that's 1 round. So now I'm gonna go back into my teeters and I do 10 of these. I typically take a minute rest in between. I'm doing 10 little teeters, and then I'm doing 10 of my side steps. I almost tripped right there. 10 of my 1-inch little steps back, 10 going to the side, and then 10 driving forward. Now be really careful with these because the band around the knees, really, it can be a fall risk. So be very careful when you're doing this stuff. You might want to just unclip this and take it off in between sets. But we're going to do 3 rounds of that. At any age, you should be able to do these exercises, and we should get better with our execution consistently just by firing all the right muscles and getting in the correct positions, which all the cues were here in the video. If anything's not clear or the distance of the view, like let us know in the comments so we can tighten this up. We really want to help you, and you can fix a lot of these things from the comfort of your own home. When we're strong and we're driving out from our hips, we take so much stress off our lower back, and that's what's going to keep you healthy long term. Okay, so we went through the exercises, we went through our warm-up, mobility, doing the hip hinge, and then doing this routine where we're actually getting hip strengthening. We want to run through those hip strengthening exercises 3 times. Please check out the videos on hip mobility, the biomechanics of the back. Make sure that you have a really good understanding of what we're trying to accomplish. The clients that do the best with us have a really sound understanding of the biomechanics, the things that they're trying to accomplish, and when they do that, it really empowers them with knowledge. Check out our videos on hip mobility, check out our videos on sciatica and back pain, and we'll have links in the description below. We'll see you in the next video. Get mobile and stay active.